they decided to increase it to a secondary. And how they determine primary means it directly causes the problem, meaning just the mere presence of these causes will lead to otitis. Now remember, otitis is not a disease, it's a diagnosis. Secondary, by themselves, they cannot create the disease, but if there's something wrong with the ear, then disease happens. Predisposing as a cause, it increases the risk, but by itself again, not the main cause. Perpetuating factors are the factors that lengthen the time. Changes in the anatomy or physiology, how do you say it? Well, perpetuates the infection. Some of the primary triggers, one of the most common ones, or one of the most frequent ones will be allergies. I think everybody's well versed with either food or environmental or atopy. We know that when the dog is allergic, the skin becomes inflamed. When the skin becomes inflamed, the mortar or the connection between the cells loosens up. Therefore, the cells are now more prone to developing infection. Ectoparasites, ear mites, mange, ticks, they can be in the ear canal, and by the mere presence or the action of biting and the moving around can cause inflammation and otitis. Hypothyroid is an endocrine disease, can lead to otitis. Autoimmune diseases, pemphigus and DLE or discoid lupus erythematosus. This part, foreign material, it's not that common in the Philippines, but in California, there's a certain weed called the foxtail, which causes a lot of ear problems. I forgot to put a picture of it here, but the rumor is foxtails were planted in California by a veterinarian, so we will have something to do during the summer months. Neoplasia, ear tumors and polyps. Keratinization disorders. This primarily refers to the defect in the normal clearing mechanism of the ear. Let's see if this will play. This is a video of ear mites. I purposely took down the volume, but you can see the ear mites crawling around inside the canal. Obviously with us, if you do not have an otoscope, you will be able to diagnose ear mites with the use of an ear swab. This is what I was mentioning about foxtails. In this video image, you can actually see one of the stems of the foxtail. The foxtail is like a weed wherein the segments or the seeds are very pointed. These particular points, because of the way they're shaped, once they get to the ear canal, they only travel one way. They're like barbed arrows. They travel one way and they go down, 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 deep into the canal until they puncture the eardrums. Foxtails are also able to cause abscesses in the skin, especially in hairy dogs, wherein it penetrates the skin, creating fulminating abscesses. We've found them inside the mouth, inside the nose, and also trapped between the eyelids. So, as they said, maybe a California vet planted them all. This is how we take them out. You use an alligator forceps, and definitely the pet has to be under anesthesia. You do not want the pet moving around because it might cause more damage. And these are some foxtails that we were able to take out. You should take a note, there's a very, very sharp point, and all the, I don't know if you call them leaves or parts of the seed are pointing backwards like an arrow. So they only travels one way. Sayang walang ganyan sa Pilipinas, then mas maraming kikita yung veterinary. Okay, this is a video of proliferative changes or growths inside the ear. I hope it's clear enough. There we see, we go in, it's a very hairy ear canal, and then you'll see all these little growths inside. These are brought about by the chronicity of the problem. By their mere presence, it eliminates the smoothness inside the canal and thereby stop the ear from cleaning itself and getting all the secretions out. This is another one. This is the other ear. There's one huge dangling polyp at the opening. There we go. Hello. So yan ang gugulat sa inyo. And as you go beyond it, you can see there's a lot of secretions. It's really, really wet and disgusting. If you have a video otoscope and you're able to show this to the owner, more often than not, they would say yes to whatever you will suggest. Okay, so secondary factors. As I mentioned, it causes or contributes to the pathology in the ear in combination with primary or predisposing factors. And bacterial and fungal infections, these are secondary because you can have normal levels of bacteria and fungi inside the ear without causing an infection. But if there's a change, such as an increased moisture, accumulation of fluid, a lack of drying out, trauma, and so on, then they become a problem. Predisposing factors are those that contribute to the disease but do not directly cause it, such as we already mentioned moisture. So if you have moisture but no bacteria, it should be fine. In the Philippines, this may be a bit of a problem in terms of humidity, other secretions, debris in the ear. This will be your wax, dirt, if your dog likes to roll around in the dirt, and, well, in California, foxtails. Stenotic canals. This is a result of chronic inflammation. Floppy ears. We know that the poster child for otitis is the Cocker Spaniel. Excessive hair in the ear canals. The hair has a tendency to block airflow, block secretions, and trap moisture. Trauma to the canal, obstructions, and we're back to moisture again. Perpetuating, these are the ones that if they're present, makes the process really, really long, okay? It prevents the resolution or exacerbation of otitis. Again, the infectious agents, it means if you're not able to control it. Chronic changes, hyperplasia, stenosis, calcification, and otitis media. Or why otitis media? Because if you're just treating infection on the outside, but you're not treating the source of infection, which is in the middle ear, then you won't be able to gain control of the problem. So how do you start? So obviously you want to get a detailed clinical history. I always tell my, interns, I do have sometimes interns or slaves, as I like to call them. I hope they're there somewhere. You get a good clinical history. When you say history, you don't just put there, let's say, vomiting, scratching ears. That is not history. History means how long has it been scratching the ears? When did it start? Because if you're looking for seasonal changes, you want to know that particular problem. So history, always put a time element in your questioning. When did it start? How long has it been? Is it getting worse? Are there any things that happened before this? And so on. Then you do a complete physical and dermatologic examination. The main problem I see in a lot of practitioners is if the dog presents for an ear problem, they go directly to the ear. They forget about the rest of the body. And this holds true not just in ear problems, but for any particular complaint. I would suggest you make it a habit to take note of the primary problem, but go through the dog still from head to toe or from head to tail, making note of the other contributing factors that may help diagnose what the main problem is. Okay? Dermatologic history means, again, looking at the problems of the skin. Where did it start? What did it look like? Is it progressing? What are the different primary lesions, papules, pustules, scales, and the like? Then, you do not just lift the ear up and then look, oh, there's secretions, that's it. You examine very well, palpate. This, I find that a lot of vets don't do. You have to compare, you have to palpate the ear canals themselves. Are they still soft? Is it inflamed? Is it already stenotic? Is it very hard? Does it feel like there are polyps inside? Does it feel like normal or not? And then always compare left and right, because not all problems are bilateral. It may be just unilateral, so at least you have a normal one to compare to. This, again, this one holds true when you're examining paired organs, eyes, ears, legs. Always make a comparison and use that comparison to tell you how bad it is. Who knows if the dog really has like 2 broken legs and you have no idea what's right or wrong. Look for the discharge. Describe the discharge. And then this, in terms of smell, you can use it as a descriptor, but it does not necessarily make your diagnosis. You don't say, aha, this smells like bacterial infection, or this smells like yeast. It may just suggest, but don't bet your license on it. Okay? Then what's important, you look for a primary or secondary cause, or at least try to figure out what the cause is. You are going to treat the problem, but if you don't treat the actual cause, you're not able to find it, then the problem comes back. Routine health screens means blood work, urinalysis, and endocrine testing if indicated. If you see that there are also lesions all over the body, loss of hair on the skin, maybe it's a thyroid issue. You may want to run, instead of just your wellness check, you may also want to run a thyroid check. Equipment. Obviously, oh, okay. Are we catching up? I lost you. Can you still hear me?
Yes.
Can you still see the screen? Because I cannot see you guys.
Yes.
I don't know if you're sleeping or not. Are you sleeping?
No.
Okay, very good. So, otoscope. Basic handheld otoscopes come with either a diagnostic head or a surgical head. And if you have the resources, it's highly suggested to get a video otoscope. I looked around, I think one of the last ones I saw is a video otoscope, well, at least the nicer ones, comes to around $15,000. So if you have the money, go for it, because especially if you have a lot